Cetrizine, one of the most common antihistaminic medication used for the treatment of several severe to moderate allergic conditions including cough and cold. Hello everyone, this is Saurabh from PharmAcharya and welcome to MedTalk. In this video, I'll discuss about Cetrizine and Levocetrizine. Based on the targeted receptor on which antihistaminics act, they are classified into H1, H2, and H3 antagonist. H1 antihistaminics are also known as conventional antihistaminics and they are classified as under highly sedative antihistaminics, example diphenhydramine and dimenhydrinate, moderate sedative antihistaminics, example phenyramine, mild sedative antihistaminic, that is chlorpheniramine, and non-sedative antihistaminic, that is cetrizine and levocetrizine. Now let us find what histamine is. Histamine, meaning tissue amine, is almost abundantly present in animal tissues and in certain plants, example stinging nettles. It is mediator of hypersensitivity phenomena and tissue injury reactions. Histamine is present mostly within storage granules of mast cells. Tissue rich in histamine are skin, gastric and intestinal mucosa, lungs, liver, and placenta. Non-mast cell histamine occur in brain, epidermis, gastric mucosa, and growing regions. Histamine is also present in blood, most body secretions, venoms, and pathological fluids. How histamine gets synthesized, stored, and distributed in the body. Histamine is beta imidazole ethylamine. It is synthesized locally from the amino acid histidine in the presence of enzyme decarboxylase. It also gets degraded rapidly by oxidation and methylation in the presence of enzyme N-methyltransferase and diamine oxidase. You can see from the given below pictures the synthesis and further degradation of histamine. There are four different types of histaminergic receptors by acting upon which any chemical compound either produces action similar to the histamine or produces action opposite to that of the histamine. The action producing similar to the histamine substances are known as agonist of histamine, and those compounds which produces actions opposite to that of histamine are known as antagonist of histamine. Four types of histaminergic receptors have now been clearly delineated and cloned. Analogous to adrenergic alpha and beta receptor, histaminergic receptors are classified into H1 and H2 receptor respectively. A third H3 receptor, which serves primarily as an autoreceptor controlling histamine releases from neurons in brain, was identified in 1983. H1 antagonists are also known as conventional antihistaminics, those drugs which competitively antagonize actions of histamine at the H1 receptor are known as H1 antagonists. These are also known as conventional antihistaminics. Qualitatively, all H1 antihistaminics have similar actions, but there are quantitative differences, especially in the sedative property. The important pharmacological action of H1 antagonist includes antagonism of histamine. They effectively block histamine induced bronchoconstriction, contraction of intestinal and other smooth muscle, and triple response, that is, wheal, flare, and itch. Anti-allergic action. Many manifestations of immediate hypersensitivity type 1 reaction are suppressed. Urticaria, itching, and angioedema are well controlled. The older antihistamines produced a variable degree of CNS depression. This appears to depend on the compound's ability to penetrate the blood-brain barrier and its affinity for the central H1 receptor. Individual susceptibility to different agents varies considerably. The same drug and dose may incapacitate some subjects while other may remain alert. First generation antihistaminic were more sedative as compared to the second generation antihistaminics. Some individuals also experience a stimulant effect like restlessness and insomnia. Excitement and convulsions are frequent seen at toxic doses. The second generation antihistaminics are practically non-sedating. Certain H1 antihistamines are effective in preventing motion sickness. It is not clear whether this is due to antagonism of histamine in the brain or reflects antimuscarinic property of these drugs. Promethazine also controls vomiting of pregnancy and other causes. This was the effect of H1 antagonist on CNS. Anticholinergic action of H1 antihistaminics. Many H1 blocker in addition antagonizes muscarinic action of acetylcholine. The anticholinergic action can be graded as high, low and minimal or absent. You can see from the given below table. If used concurrently with atropine or its substitutes, phenothiazines, tricyclic antidepressants or dispyramide, the anticholinergic action adds up. Some drugs like phenyramine, promethazine, diphenhydramine have strong while others have weak membrane stabilizing property. However, they are not used clinically as local anesthetic because they cause irritation when injected subcutaneously. BP. Most antihistaminics cause a fall in blood pressure on IV injection. However, this is not evident on oral administration of H1 antihistaminics. Now let's discuss about cetrizine and levocetrizine. Cetrizine, it is a metabolite of hydroxyzine with marked affinity for peripheral H1 receptor. Penetrates brain poorly, but mild sedation and subjective somnolence is experienced by many recipients. It is not metabolized, does not prolong cardiac action potential, or produce arrhythmias when given with erythromycin or ketoconazole. Cetrizine, in addition, inhibits release of histamine and of cytotoxic mediators from platelets as well as eosinophil chemotaxis during the secondary phase of the allergic response. Thus, it may benefit allergic disorders by other actions as well. It attains high and longer lasting concentration in skin, which may be responsible for superior efficacy in urticaria, atopic dermatitis, as well as for once daily dosing despite elimination T half of 7 to 10 hours. It is indicated in upper respiratory allergies, pollinosis, urticaria, and atopic dermatitis, also used as adjuvant in seasonal asthma. Levocetrizine is the active enantiomer of cetrizine. It is effective at half the dose and appears to produce less sedation and other side effects. From the given below picture, you all can see the molecular structure formula of cetrizine and levocetrizine respectively. Now let's study about the pharmacokinetic property of cetrizine and levocetrizine. The conventional H1 antihistaminics are well absorbed from oral and parenteral routes, metabolized in the liver and excreted in the urine. They are widely distributed in the body and enters brain. The newer compounds penetrate brain poorly, accounting for their low or absent sedating activity. Duration of action of most agent is 4 to 6 hours except meclozine, chlorpheniramine, loratadine, cetrizine and fexofenadine, which acts for 12 to 24 hours or more. These are the associated side effect and toxicity of H1 antihistaminics like cetrizine and levocetrizine. Sedation, diminished alertness and concentration, light headache, motor incoordination, fatigue and tendency to fall asleep are the most common side effects observed. Objective testing shows impairment of psychomotor performance. Patients should be advised and cautioned not to operate motor vehicles or machinery requiring constant attentions while they take cetrizine or any other H1 antihistaminics medications. Few individuals become restless, nervous, and are unable to sleep. Second generation compounds are largely free of CNS effects. Dryness of mouth, alteration of bowel movement, urinary hesitancy, and blurring of vision can be ascribed to anticholinergic property. Epigastric distress and headaches may be felt. Local application can cause contact dermatitis. These are the uses or application of the H1 antihistaminics like cetrizine and levocetrizine. They are extensively utilized in the treatment of allergic disorders, used in the treatment of cough and cold, used in the treatment of motion sickness, as well as in the treatment of morning sickness based on the symptoms. Used in the treatment of vertigo. Vertigo is a condition in which patient feels or have sensations that the patient itself or their environment is in the continuous state of motion, either circular or spinning. Cetirizine is used in the treatment of vertigo. They are used in the pre-anesthetic medication and symptomatic treatment of Parkinsonism. The prescribed dose of cetrizine is 2 to 10 mg per day, and that of levocetrizine is 5 to 10 mg per day. Dose should not increase 10 mg per day. Some available marketed formulation of cetrizine are Cetrizine Tablet and Cetrizine Tablet. Other available formulations of levocetrizine includes Levorid, Levocet 5 mg tablet and 10 mg tablet, Levocet syrup as well as tablet. That's all in this video.